Hi, and welcome to Microscope Fundamentals for Vet Assistants. This video is intended to introduce you to the basics of using a microscope. Here we have Dr. Pisano demonstrating the correct technique for bringing a microscope into focus. This was not really planned for her to be a part of the video, but the microscope is such a useful tool in everyday veterinary practice that during the course of recording this video, she required the use of the microscope slide. And what we're seeing right here is her demonstrating a gentle technique when bringing it into focus. This particular slide that she's looking at right now was obtained from a patient who came in to have a mass evaluated, and by use of the simple tool of light microscopy, Dr. Pisano was able to make an accurate diagnosis and a treatment plan for this patient. In this particular case, it was a mass that needed to be removed and it's possibly life-saving, and all of that is possible thanks to some quick, inexpensive, and easy equipment that we're able to use on an everyday basis in our microscope. It's a foundation for so many different things. As you can see here, the common light microscope or compound light microscope will have multiple objective lenses, which are the component that allows light to pass from the light source up through into the eyepieces, and it magnifies what we want to look at, and it allows us to evaluate individual cells and make accurate diagnoses based on these cells. The first step is to collect your sample. This is a particularly yucky ear swab. It's way too thick, but we got a more appropriate swab size for this presentation. Now, I break the stick here to denote which comes from the left ear and which from the right ear. When preparing your slide, you're going to place it frosted edge up and then gently roll back and forth to apply the slide and the sample together. This will give you a nice light uniform layer, as you can see. This is a poor technique. We never want to slide or rub because that can damage the cells that we're trying to identify and make it impossible to get an accurate diagnosis. The next step is heat fixing our slide. So as you can see here, we never want to actually have the flame touching the slide. It's simply underneath it. It doesn't take a great deal of time. Next, we're going to look at our diff quick slides. This hospital has them appropriately labeled. You're usually going to find two sets, one for skin and ears and the other for blood. The clothespins that are on the edge are used to hold the slide when we're dipping the technique. Now, Dr. Pisano has chose to just do more of a hold technique, and she counts to about 10 to 15, but I think I was making her nervous when I was filming because she lost count a couple of times. In the end, it doesn't really matter how long you hold it or how many times you dip it into the stains, as long as you're consistent with the way that you do it, so that when you move from one slide to the next, you're evaluating at the same level. One of the other things that you can notice here is that when she pulls it out of the container, the slide itself will have a thin layer of stain, and we're going to see that right now. This is me doing the dip. I'm using the clothespin, and I'm a 10 dip per stain guy. I tend to do it at a moderate pace, and really what I'm looking for is that same kind of film to form. This first step is a fixant. The second step is the red step, and what this will do is, as you can see, adhere, and it makes all of our cells on that slide pink or red. The technical name is eosin. And that's all just details. The third step of this will counter stain that pink slide. And as you might have noticed, I tap any of the excess stain on the slide right onto the edge or lip of that glass which will allow that to run back through. Once our slide is properly stained, we're going to rinse, and we want to make sure that we're hitting the top and letting the water run over the slide, not directly onto our sample that we just prepared, to prevent losing it to water flow. Now we're ready to move to the microscope. The first step is to adjust the controls. Here I am showing you the coarse and fine adjustment, the outer knob there, the fine adjustment. The inner knob that I'm turning right here is the coarse adjustment. And as you can see, the coarse adjustment has a large impact on how the stage moves up and down. This outer knob, not so noticeable as the fine adjustment. These controls on the right side of the microscope usually are to control the movement of the stage back and forth and left and right. And this is going to allow you to position your slide in an appropriate area to find something you're interested in. Now, before we get into putting the slide on, we're going to turn the microscope on. And a lot of them have a knob to adjust the light source. And that's what I'm going to do here is I'm going to turn it up and down. And as you can see, that will impact how much light is coming through. Higher powered objectives do not necessarily require the same amount of light as lower power objectives. But usually, once you turn this on, you won't need to adjust any finer than what you have already. Now we're going to tape the microscope slide that we just prepared that has been thoroughly dried by air or by hair dryer is my preferred technique. But the most important thing is that you get your slide completely dry. Any kind of water that's remaining on a slide after you prepare it can cause for artifacts, and those artifacts are fake. They don't really exist on the slide, and they can cause you to either misdiagnose or miss a diagnosis. Now, everybody's eye focal length is a little bit different, so you don't need to be directly on the eyepieces to see in and see through to the slide. Now, you're going to want to keep both eyes open with a binocular microscope, such as the one that we're using here. And as you saw briefly, I adjusted the actual width to fit my face in that first encounter with the microscope. Now, we're going to bring it into focus on the lowest power objective and then rotate through to higher power objectives, which you'll see me perform here. I've moved from the 10 power, which is the pan and scan, to a 40 power objective. Now, the reason for this is that I can get a better look at the cells, but still have a wide enough view to narrow in my area of focus to what I think is going to be good to make an accurate diagnosis from this particular slide. Once we have the 40 power objective where we want it, we're going to rotate it clockwise to get it out of the way and move to the wet objective. The wet objective is the 100x, and it's often marked with a white line. This is the only microscope objective lens that requires oil. Now, after you are finished, I like to lower the stage so that I don't contaminate any of the other objective lenses with oil. Oil is very helpful, but it can also dry on an objective and subsequently ruin that objective. So what we do after we're done with the oil objective is we're going to grab a Kim wipe or other soft lens paper, and we're going to blot it dry. You never want to use a circular motion when you're doing this because it can cause damage to the lens. And in this particular case, I had dripped a little bit of immersion oil, so I wanted to wipe that off the stage as well to be polite and set up for the next person coming behind me. Once you've completed your viewing of the microscope slide, make sure to turn off the light and the power source because those have a limited supply. Thank you for watching. I hope this video was helpful with some basic techniques as far as staining and evaluating slides.